The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hello, everyone. Welcome back to another episode of Go to Health. My name is Jonathan Marks, your host. And today we are talking about the health crisis in Black maternal health. We're talking today with Dr. Jamil Norman, PhD, RN and CNE, which is Certified Nurse Educator. She's the Associate Dean of the BSN program at Walden University, and she is a Certified Nurse Educator and has over 20 years of experience as a registered nurse and over 15 years in higher education. Throughout her career, Dr. Norman has served as an agent of social change in the roles of educator, researcher, and mentor. Currently, she serves as a member of the American Association of Colleges of Nursing, Diversity, Equity, and Inclusion Leadership Network. As a nurse researcher, Dr. Norman works to advance the body of evidence in pregnancy-related health disparities among African American women. Welcome to the show, Dr. Norman. How are you today?
I'm good. How are you? It's so great to be here.
Good. I'm glad you're here too. So we have an important week coming up that recognizes Black maternal health. Can you tell us what this event is and what you want to be talking about today?
Yeah, so the Black Maternal Health Week encompasses so many different aspects. There will be webinars and a lot of just mobility out there so people can recognize this health disparity among Black women. And so Walden University is actually having a panel discussion so we can, make more people aware of the crisis and we can get some action behind it as well.
Great. And this week is happening when?
This is happening the week of April 15th through the 19th.
Wonderful. Good. And Jamil, describe for us this health crisis in Black maternal health. What are we seeing here?
We are just seeing a drastic difference in healthcare outcomes with Black women. You will see that Black American women are dying at a rate that's 3 times higher than white American women. And this disproportion has been something that we have really been trying to figure out exactly what are the issues and what we can do about it. Because in this day and time, Black women should not be dying at this rate, at this unproportional rate.
And do we know the causes at all?
So that's something that we're still really trying to work out, because historically, people thought that it was women that did not get appropriate care, or it was women that may have been on drugs, or so many different factors that are not actually the case. Mm-hmm. And so now we're really trying to work to see if there are differences in the way that Black women are treated whenever they are pregnant. You're hearing a lot, especially in the research that I've done, is that women are not feeling heard. And so the treatment outcomes are different because their concerns are not actually being heard. Mm-hmm. And we are just trying to make sure that Black women have a voice and healthcare providers are actually listening and making those changes to accommodate whenever women are having any issues with their pregnancy or in their childbirth time period.
So communication is a two-way street, and I'm curious, do we know, is there an issue with Black women speaking up or recognizing symptoms they should be aware of? Are they educated enough and assertive enough to speak up for themselves? And the second issue is, as you mentioned before, are they being heard? Can you distinguish between those two?
And so, that is something that is also being researched. There is a dearth in the research about exactly, that. And so Black women are being educated. You will see that the typical patient that you think should have no issues, a highly educated They have prenatal care. They're very aware of what's going on with their body, are
Mhm.
still some of those women who have had issues. For example, you've seen in the news when Serena Williams actually had her child and all the issues that she had. And none of the things that we thought, previously were factors for her. She has plenty of money. She is well known, educated, and was very in tune with her body and was not heard. And
Hmm.
so right now, I think there's really just the force out there to make sure that women understand their bodies and know what to expect during pregnancy. They can identify some of the issues that may occur because as women, we know our bodies better than anyone else. And
Mhm.
so, those are some of the things that you can see that are going on right now, trying to make sure that women are aware and that the healthcare providers are aware as well.
Right. Just for an example, can you tell me some of the specifics about how Miss Williams was not heard? Do you know any of the specifics there? So we can use that as an example.
Right. She actually, after she had her child, when she went home, there were issues that she was having with her blood pressure, with,
Mm.
just the way that she was feeling. And a lot of it was chalked off to, this is what happens with pregnancy. And then it actually escalated.
Mm.
And it was one of those things that she had to be very persistent, and she felt that she was, that things could have really gone wrong if she wasn't as persistent. That's the case, but sometimes for other women what is happening is that they're not heard and they actually die
Mm.
because of not being heard. That's what we're trying to make sure we prevent.
And in terms of being heard, so you really focus on nursing education. Tell me about the role that nurses can play in working with a patient, whereas the doctor may come in and have 15, 20 minutes. The nurse may have a little bit more personal time or personal connection. Can you describe what that dynamic might be and how that might be improved?
I think the great thing with nursing is that we can be with that patient throughout the entire period and really have the time to focus on the education that they need. And
Mhm.
so, depending on what is going on with the patient, we can educate them on their specific diagnoses if they have any issues like, let's say, gestational diabetes, or if they have pregnancy induced hypertension, we can make them aware of their condition and what they need to do to have a good health outcome. Also, we want to make sure that they understand, not just during the pregnancy, but also after they have their baby. So in that postpartum period, a lot of people think, okay, I've had the baby, I'm good, the baby's good, and everything should be fine. But there's a critical point after you have your baby in that postpartum period that we want to make sure that you're really good. And so making them aware of if they're bleeding too much, if they're not feeling well,
Mm.
if they feel like they're going to pass out, and, all the things that could really escalate and, increase their a chance of, maternal mortality. So we want to make women very aware of their specific healthcare needs and try to make sure that they are not only educated, but they take their medication if they need medication, right? When they're pregnant, because, a lot of people, may not understand what they need to do for themselves and their baby while they're pregnant. So I think that's really one of the things that nurses are able to do because we have more of that time with the patient and we're consistent with that patient throughout their prenatal care period and hopefully while they're, laboring in that postpartum period.
Got it. And are there educational programs that exist right now that can address these issues for nurses?
Oh, definitely. There's so many different aspects. Not, I mean, even outside of nursing, you have nurses who work with patients prenatally. Then, of course, you have your labor and delivery nurses. You have your postpartum nurses, and then you also have your nurses that will go out to the patient's home in the community to make sure that they're doing well, that their child is doing well, after pregnancy. There are other people such as doulas, your nutritionists. There's so many healthcare providers that can really be an asset to patients during their pregnancy and throughout, even during their postpartum period and those first, critical months, that first critical year, honestly, for their newborn as well.
That's very enlightening. So what you're really suggesting, Dr. Norman, is that people really take advantage not only of talking with their doctor, but also talking with the support staff, the nurses, the doulas, whoever else they're working with, and really make sure they're getting heard and listened to and getting a response that can be helpful.
Correct. Because, nurses we're advocates for our patients, but then we also teach patients how to advocate for themselves as well.
Wonderful.
And so, we want to make sure that our patients have all the tools, all the education for themselves, and that they have the support that they need.
Now, I know you said you don't know the causes for this, but I'm wondering, is there an association between the rates of diabetes or high blood pressure among Black women that's higher that could be a cause for these difficulties? Do we know any of that yet?
Well, so that would be for all women, right? If you are pregnant and you have gestational diabetes, you have pregnancy-induced hypertension, these are those things that are considered complications. And so any woman that has a complication that, we would want to make sure that we're really looking at them and we're taking care of them. But what is happening is that you will see that if there is an African American patient and a Caucasian patient that have the same pregnancy complications, that at times they're treated differently. And so, that's what we want to make sure that we're really looking at, those health inequities. And, one prime example is that when I was in nursing school, they were saying that, culturally, African American women have a higher pain threshold. That's absolutely untrue. But if you are being taught that, then how does that affect how you take care of the patient? And so that's why we're trying to make sure that our healthcare providers are truly educated culturally and understand, that you look at each patient as an individual, and that you want to make sure that you're listening, paying attention to all of the things, their lab work, you're looking at the fetal heart rate monitor, you're paying attention to every single thing that could lead to a poor outcome.
So Dr. Norman, can you tell us more about these health inequities? When you say inequities or that we need more equity, what do you mean by that? What are some examples of that so we have a better understanding of these differences and how patients are treated?
Right. That's really the core of it, is the difference in the approach of care. And so, whenever you're thinking about access to care, do we make sure that all patients have equal access to care? Do we make sure that whenever they are in our presence and we're caring for them, that we're looking at our biases? Because that's one thing, is that everyone has biases, but we want to make sure that does not portray whenever we're taking care of a patient, that we are looking at that patient and treating them equally as you would any other patient. And so those are the things that we're trying honestly to figure out. Is there a difference in the way that healthcare providers are providing care to Black women? Do those biases come out whenever you're caring for that woman and you don't even realize it? And that is then impacting their healthcare and their healthcare outcomes.
So we've been talking with Dr. Jamil Norman, PhD, RN and CNE, certified nurse educator. She's the associate dean of the BSN program at Walden University. And we're talking about the Black maternal health crisis. Now, if you're interested in attending or watching a replay of the event that Walden University is putting on, you can go to this website, and I'm going to give you a bit.ly link. It's bit.ly, bit.ly/Black Mom Health. bit.ly/Black Mom Health. And if you're interested in getting in touch with Dr. Norman directly, you can do that. She welcomes that. Her email address is Jamil, which is JAMIL.Norman, NORMAN, Jamil.Norman at mail.waldenu.edu. Great. So we will be back with Dr. Norman after this break, and we will be talking more about how she got into the kind of work that she does and how you can learn more about supporting women when they're pregnant. Stay with us. We'll be right back. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.